The cough started in September, persistent and deep, rattling in my chest like broken glass. By October, I was coughing up blood. By November, I'd lost 18 pounds and could barely climb a flight of stairs without needing to sit down. "It's just a cold, Jessica," my mother said at Sunday dinner, not even looking up from her plate. "You've always been prone to respiratory things. Take some vitamin C." My sister Charlotte nodded, scrolling through her phone. "Mom's right. You look fine. You're probably just stressed from work." I was 29 years old and Director of Medical Licensing and Ethics for the State Medical Board, the person who reviewed every complaint against doctors and nurses, every license application, every ethics violation. It was a position that required absolute integrity and attention to detail. Medical professionals across the state knew my name and respected the office I held. My mother was one of those professionals. She'd been a nurse practitioner at Mercy General Hospital for 12 years, and she never let anyone forget she was the medical expert in the family. "Mom, I'm coughing up blood. That's not normal." She rolled her eyes. "Hemoptysis. Look at you using medical terms like you went to nursing school. It's probably just irritation from coughing too hard. You're being dramatic, like always. I feel terrible. I can barely get through a workday. You work too hard. You create your own health issues through stress. Remember when you thought you had mono in college? It was just fatigue. I did have mono. I was hospitalized for 4 days. Well, you recovered. My point is, you catastrophize normal symptoms. It's a personality thing." My father barely glanced up from his phone. "Your mother knows what she's talking about, Jess. If she says you're fine, you're fine." Charlotte put down her phone long enough to add, "Honestly, are you going to make this entire dinner about your cold? We all feel bad sometimes. Just deal with it." I left early that night, my chest aching from more than just the cough. Over the next 3 weeks, the symptoms intensified. More blood. More weight loss, 23 pounds by mid-November. Night sweats that soaked through my sheets. Colleagues at work started asking if I was okay. I looked gaunt, pale, sick. My mother's response never changed, "You're fine. Stop obsessing over minor symptoms." On November 18th, I collapsed at work. One moment I was at the copy machine, the next I was on the floor, my assistant Kelly screaming for someone to call 911. I woke up in the ER at St. Catherine's Medical Center. Dr. Sarah Patel sat beside my bed, her expression grave. "Jessica, there's a mass in your left lung. A significant one. We need to do more imaging immediately. I'm admitting you right now. A mass. Like a tumor. Based on your symptoms, chronic cough, hemoptysis, weight loss, fatigue, I'm very concerned this is lung cancer. How long have you had these symptoms?" 3 months. Maybe 4. Her expression darkened. "Have you seen a doctor?" My mother is a nurse practitioner. She said it was just a cold. That I was being dramatic. Something shifted in Dr. Patel's face, a hardness in her jaw. "Your mother is a medical professional, and she told you coughing blood for months was just a cold?" "Yes." "And she didn't recommend you see a physician?" "No. She said I was creating health problems through stress." The CT scan revealed the full horror, a 6-centimeter tumor in my left lung with multiple suspicious lymph nodes. The biopsy confirmed stage 3B non-small cell lung cancer. Advanced. Aggressive. In a 29-year-old who'd never smoked. My oncologist, Dr. Marcus Chen, was blunt. "This is serious. We need aggressive treatment, chemotherapy first to shrink the tumor, then surgery to remove part of your lung, then more chemo. With treatment, you have a fighting chance. Without it, 6 months to a year." "How long has this been growing?" 8 to 12 months, maybe longer. If we'd caught this 6 months ago, we'd be looking at stage 1. The prognosis would have been 70 to 90% 5U survival. Stage 3B is 20 to 30%. The numbers hit like physical blows. Because it wasn't caught early, my chances of living had dropped by 60%. I called my mother. "Mom, I'm at St. Catherine's. I collapsed. They did tests. I have lung cancer. Stage 3B. It's spread to my lymph nodes. Long pause. Then, that seems like a very dramatic diagnosis, Jessica. Are you sure they have it right? I think you need a second opinion. These doctors might be overreacting. I've seen 3 oncologists. They all say the same thing. I have a 6-centimeter tumor and affected lymph nodes. I need chemotherapy and surgery in January. January? Her voice shifted to irritation. That's terrible timing. Charlotte and I have our spa retreat planned for mid-January. Canyon Springs Resort. We've had it booked since June. I couldn't process what I was hearing. Mom, I need surgery to remove part of my lung. Surgeries can be rescheduled. Can't you ask them to do it in February? I'm sure they can be flexible. Every day we wait, the cancer could spread further. Don't take that tone with me. I gave you medical advice based on what you described. How was I supposed to know you had cancer? You said you had a cough. I told you I was coughing up blood. Lots of things cause that. You're acting like I should have diagnosed cancer over the phone. That's completely unreasonable. And I'm sorry your timing is inconvenient, but Charlotte needs this spa weekend. Surely you can understand we can't cancel our plans for a medical appointment. This isn't an appointment. This is cancer surgery. Whatever you want to call it, we're not canceling. You're an adult. You can handle a hospital stay on your own. We'll visit after we get back. She hung up. Kelly became my lifeline. She sat with me during chemotherapy infusions while toxic chemicals dripped into my veins. My work colleagues sent flowers and cards. The medical board assured me my job would be waiting. My family sent a fruit basket. The card said get well soon. The chemotherapy was brutal. I lost my hair, dropping to 102 pounds on my 5'7" frame. I looked skeletal, like death was already claiming me. But the tumor was shrinking. My mother called twice in those months. Once to tell me about Charlotte's promotion. Once to ask if I could please reschedule the surgery because Charlotte and I really need this spa weekend. I blocked her number. In mid-December, working from home between chemo sessions, something appeared on my desk, a license renewal application for Patricia and Henderson, NP. My mother. Every nurse practitioner had to renew every 3 years. It was routine bureaucracy applications I'd reviewed thousands of times. This one made my hands shake. I called our ethics attorney immediately. Tom, my mother's renewal application just came across my desk. I need to recuse myself. That's the right call. But Jessica, you sound upset. Is there something else? I need to file a formal complaint against Patricia Henderson for gross medical negligence. Long pause. Your mother. A nurse practitioner who dismissed obvious cancer symptoms for months, actively discouraged medical care, and gave harmful advice without proper examination. I told him everything. The dismissed symptoms. The just a cold diagnosis. The text messages telling relatives I was making a fuss over minor symptoms. The voicemail asking me to reschedule cancer surgery around a spa weekend. This isn't revenge, I said. If she could dismiss cancer in her own daughter, she could do it to a patient. My job is to protect the public from negligent practitioners, regardless of who they are. The complaint was filed December 18th. My phone exploded, 37 calls from my mother, 23 texts from Charlotte, 17 from my father. That evening, they showed up at my apartment. I opened the door with the chain engaged. My mother stared through the gap, shock registering on her face. I was bald from chemo, gaunt, wearing a surgical mask because my immune system was compromised. I looked like someone dying of cancer. Because I was. My God, Jessica. You look like I have stage 3 lung cancer. This is what happens when someone ignores symptoms for months. You filed a complaint against me. Against your own mother. I filed a complaint against a nurse practitioner who committed medical negligence. I did not commit negligence. I gave you reasonable advice. I pulled up our text messages and read aloud. Stop making such a fuss about minor symptoms, November 2nd, after I said I was coughing blood. You're being a hypochondriac again, November 15th, after I'd lost 15 pounds. These doctors are overreacting after my cancer diagnosis. Her face paled. You're taking those out of context. Should I play the voicemail where you asked me to reschedule cancer surgery around your spa weekend? Because I saved it. The board has copies. My father pushed forward. You have to drop this. Your mother could lose her license, her job. We'll lose her income, our health insurance. What I wanted was for my mother to take me seriously when I couldn't breathe. What I wanted was for someone to care more about my life than their spa appointment. Charlotte shoved past them. You're destroying our family over a mistake. Mom didn't realize you were sick. She's a nurse practitioner. Recognizing when people are sick is her job. If she could dismiss cancer in her own daughter, what would she do to a patient? What if she's already done it? The silence was deafening. I closed the door. The medical board investigation moved swiftly. Dr. Chen testified about how earlier detection would have improved my prognosis. Dr. Patel described my condition when admitted advanced cancer that should have been caught months earlier. The investigators reviewed my mother's patient files at Mercy General. They found a pattern, 3 other instances where she'd dismissed serious symptoms as minor or anxiety, leading to delayed diagnoses. One patient developed sepsis after she said their pain was probably stress. Another had a delayed heart attack diagnosis after she called their chest pain anxiety. A third had a brain tumor she'd dismissed as tension headaches. None had filed complaints. My complaint opened the door to examine her entire practice pattern. The formal hearing was January 10, 4 days before my surgery. I attended despite everything, wearing my professional suit altered to fit my skeletal frame, a wig, makeup hiding how sick I was. The board chair, Dr. Marianne Foster, was someone I'd worked with for years. She knew I wouldn't file frivolous complaints. Mrs. Henderson, Dr. Foster began, you're a licensed nurse practitioner with 12 years of experience and training in patient assessment. Is that correct? Yes. Your daughter spoke to you about symptoms in September through November. Can you describe those conversations? My mother's expensive attorney tried to object, but Dr. Foster cut him off. Your client gave medical advice. The fact she wasn't paid doesn't mean she wasn't acting professionally. Dr. Foster opened a folder. On November 2nd, your daughter texted, Mom, I coughed up blood. Should I go to the ER? Your response, stop making such a fuss about minor symptoms. You probably just irritated your throat. The room went silent. On November 15th, Mom, I've lost 15 pounds without trying. Your response, you're being a hypochondriac again. On November 27th, after her cancer diagnosis, you said, these doctors are overreacting. Dr. Foster looked up. These aren't casual family advice. These are medical assessments. You definitively told your daughter what she did and did not have, despite no examination, no tests, no proper history. I was trying to reassure her. By dismissing cancer symptoms? By discouraging emergency care? Dr. Foster picked up another document. On December 10th, you left a voicemail. I'm going to play it now. My mother's voice filled the room. Jessica, Charlotte, and I have our spa weekend January 12th through 15th. We've had this booked since June. You need to call your surgeon and reschedule your surgery. Move it to late January or February. This spa weekend is really important. We'll visit you after we get back. Several board members looked physically ill. Mrs. Henderson, Dr. Foster said, her voice ice, did you tell your daughter to reschedule cancer surgery around a spa appointment? My mother was crying. I didn't understand how serious. You're a medical professional. Persistent cough, hemoptysis, unexplained weight loss, these are textbook cancer symptoms. You knew, or you should have known. Which is worse? The investigation also revealed her pattern with other patients. 3 delayed diagnoses. 3 families who'd trusted her judgment. The board deliberated 30 minutes. Patricia Henderson, Dr. Foster announced, this board finds you demonstrated gross negligence. You failed to conduct proper assessment, dismissed serious symptoms without examination, actively discouraged appropriate medical care, and showed a pattern of behavior inconsistent with nurse practitioner standards. Your license is suspended for a minimum of 2 years pending ethics training and psychiatric evaluation. We're referring this to Mercy General Hospital for review of your patient care practices. My mother's face crumbled. Charlotte screamed it was my fault. My father stared at me with betrayal. I stood and walked out. Kelly was waiting with my wheelchair. The fatigue had been bad. "How do you feel?" she asked. Like I did the right thing. 4 days later, Dr. Chen successfully removed the tumor and 14 lymph nodes. The surgery took 8 hours. I woke up with Kelly holding my hand, flowers from colleagues, cards from people who cared. My family sent nothing. Mercy General's investigation revealed the 3 other cases. The hospital terminated her employment. My father called once. "Are you satisfied now that you've ruined her career?" I didn't ruin it. Her negligence did. She's your mother. She was supposed to protect me. She's a medical professional. She knew better. You've destroyed this family. No, Dad. I survived it. I underwent 4 more months of chemotherapy. The cancer went into remission. My hair grew back. I returned to work. My mother's suspension became permanent after she failed the psychiatric evaluation. The assessor found she lacked necessary empathy and judgment. She got a job in medical billing. The spa weekend never happened. She was too stressed to enjoy it. Charlotte stopped speaking to me. My father sends birthday cards, nothing more. Dr. Chen celebrated my 1-year cancer-free anniversary with me. So did Dr. Foster and the medical board. So did Kelly and my colleagues. I'm 31 now, cancer-free, still serving as Director of Medical Licensing and Ethics. I review applications without bias and hold professionals to the standards they swore to uphold. My mother called last month. "Jessica, I need to talk about getting my license reinstated. You'll need to file an application. It will be reviewed by the board. But you could help me. I could have helped you, Mom. When I was coughing blood. When I was dying. You chose a spa weekend instead. Are you ever going to forgive me?" I already have. But forgiving doesn't mean trusting you with patients' lives. Some mistakes don't get second chances. I hung up. My lungs clear. My conscience clearer. The tumor is gone. The family that dismissed it is too. And I'm finally breathing freely.